Okay, good afternoon. This is Elizabeth Hardig with the American Planning Association. Thank you so much for joining us for our webinar on downtown Colorado streets. We're excited to have a wonderful speaker today, Kate Townley, who will be sharing a little bit more about her work in Colorado. But before we dive into the session content, we wanted to share a bit more about what's happening at APA and the Healthy Communities Collaborative. Many of you, I know, are familiar with our Plan for Health project, a CDC-funded initiative to really bring together planners and public health professionals across the country. And a way for us to continue that conversation is through the Healthy Communities Collaborative. So we've invited Grace Young here today to talk a little bit about her work as the co-chair of the Healthy Communities Collaborative. Grace is also a former Plan for Health project manager with the St. Louis Plan for Health Coalition, and is continuing her work as the Planners for Health project manager right now. Grace is also the Director of Special Projects at TrailNet, an advocacy organization based in St. Louis. And Grace is tackling issues from active transportation to equity to healthy community design, and we're excited to have her here today. So Grace, I'm going to turn things over to you to kick off our introduction of the HCC.
Hey, thanks so much, Elizabeth. That's a nice introduction. So, hi everyone. As Elizabeth was sharing, I'm based in St. Louis, Missouri, and today I'm here to let you guys all know a little bit more about the work that we've been doing at APA called the Healthy Communities Collaborative. It's an interest group of APA, and it's different from a division in that we focus on trying to build partnerships where people are welcome and able to join for free. So the mission statement is Healthy Communities Collaborative is an American Planning Association interest group of planners and allied professionals who are interested in fostering cross-sector collaboration and increasing capacity to support building healthy communities through the local, regional, state, or national level. And this is a really key and important slide because I really want to emphasize about all the great work that is currently being done across our region and how can we as planners or public health professionals or people working in other sectors work together in defining what healthy communities are. One of the things that EPA recently did was announce their joint call to action that had partners ranging from engineers to ULI and APHA and so forth to really talk about how do we align our membership organizational goals as well. So why is this collaborative and why is this really important for you all to be a part of this process? It's one that we're trying to build a resources that people can use in helping us define what healthy communities are, or resources where you know that you're bought into this idea of wanting to build healthy communities, but you don't really have the tools to help you get there. So how do we do implementation work? So we want to create a collaborative that creates a supportive system and is an area that we can bridge in these different tools. We're also trying to build a movement. We're trying to bring together other folks who are very interested in this topic to the table to have these larger level discussions. And that's why it's key that we keep this an interest group for now while we really figure out how this collaborative can really work together. And we want to connect with one another as well. We know there's only so much we can do in the capacity and the roles that we have. But how do we really work together in building up a larger movement and momentum in connecting with each other, because not all of us can travel to different conferences to always meet one another. And so that way we can really leverage the work that all of us are doing and support each other in this way to really create a strong movement. But we really need you all to help us create that collaborative and create this framework of what this could look like. So the current structure is that Kayleen Cook and myself are the co-chairs. Kayleen is based in Newark, New Jersey, and she has also worked on a Plan for Health grant and has a planning background and is really interested in this idea of what are healthy communities. Her and I helped host quarterly calls and working group calls, but luckily now we are going to have bi-monthly working group calls with two great chairs. One of them will be Catherine Hebert. She's based in North Carolina, and she'll be leading our policy initiatives. And Tony DeLucia, who is based in Tennessee, will be the education working group chair. We do have a partnerships and outreach working group as well, but we're currently working on finding a chair. So after this, if you're really interested, we'd love to have you be more involved. And then, of course, our wonderful APA support staff, Anna Ricklin and Elizabeth Hartage. So this is going to be a really quick overview of each of our working groups and the type of discussions that we're having. We'd love to have you be a part of these discussions as we move forward, but for a quick review of what the policy working group has had so far in terms of discussions is that we'd like to work on developing policy guidances together. And what does this mean when we're talking about healthy communities? Looking at zoning codes within our communities and how do we build in a health framework? A health in all policies, really. So how do we really look at all the policies that affect our communities, whether that's on the local, state, regional, or national, federal level, and really seeing how we can build in this health framework, especially within our planning work as well. And then a health policy guide. So this is something that APA has been working extensively with, and our working group is currently going to help review it. There'll be a health policy guide coming out to guide planners about how we have these discussions around health and building healthy communities. For the education working group, we've been discussing about what it means when we're talking about school programming, how do we build healthy communities at the education level, and working not only with elementary, but going into higher education as well, and really working and training the next generation of professionals. Really wanting to also work in the medical field. How do we work with hospitals, community benefit programs, and also training the trainers. We as ourselves can only be as great as allies, but we want to build up partnerships across our local communities and helping create more allies to create the system around healthy communities. And of course, how do you fund any of our projects, and how do you find those fundings, and how do we shift the discussion about how projects might be funded as well around healthy communities. And then the last working group that I'm just going to quickly go over is the partnerships and outreach. How do we build new advocates? Because again, it's only so much we can do, but we need a strong movement to get us there. So how do we create this motivation? A lot of communities can probably talk about fatigue, community burnout, and how do we really ensure that we've created tools that are going to leverage the work that are going on. And then, of course, building those new partners as well within our local community, because if we only work in our siloed boxes, we're not going to be as effective. But if we can build into health, engineering, public works, so forth, and build in these new partners, it can make our work more cohesive and stronger. And of course, working with the existing partners as well, and not forgetting them to bring them along in the process. So overall, the really great thing about this collaborative so far is that in each of our calls, no matter that's quarterly or bi-monthly, we talk about a need share platform. We discuss different issues that people might be facing and share information about how to maybe support and tackle those issues as well. So if you have a burning desire to talk about anything in particular, please feel free to join any of our next calls. Or we do have a listserv as well that we'd love to have discussions about how we can work together going forward. So if you want to get more involved or contact us, Kayleen and my email is up there. But the best way to currently stay involved and at least know what's going on is by joining our Healthy Communities Collaborative listserv, and you can do that by emailing health@planning.org. And this listserv only sends about 3 to 4 emails a month, but if you ever have a question or just want to know what's going on, again, this is the best way to get involved. So I hope you've learned a lot more about this whole process and that you'll want to join our listserv to stay in touch. Thanks.
Great, thank you, Grace. That was a fabulous overview of the Healthy Communities Collaborative at APA, and a perfect way to introduce our topic this afternoon, downtown Colorado streets. So I'm excited to introduce Kate Townley. Kate is a built environment specialist for the Colorado Department of Public Health and Environment, where she works with communities across Colorado to promote active living as a way to prevent chronic disease. Kate received a Master's of Urban and Regional Planning and a Master's of Urban Design from the University of Colorado, Denver. So really exemplifies this intersection of planning and public health, and we're grateful to have Kate with us this afternoon. If you just joined the webinar, I did want to let you know that we are recording the session, and it will be available on APA's YouTube channel, as well as on the planforhealth.us website. If you have questions, feel free to use the chat box throughout the presentation, and we have saved a few minutes at the end of our session for Q&A and conversation. And I did just want to point out that we do have a video in the handout box. Kate will be talking a little bit more about the resources available to you all, but feel free to download that video anytime throughout the session this afternoon. So Kate, I will go ahead and turn things over to you.
Great, thank you. Thanks for having me today. And my role at the State Health Department is to basically work with communities to increase access to safe, enjoyable environments for physical activity. And so today I'll be talking real briefly about a resource that we recently completed in Colorado to help communities design streets to increase physical activity. Let's see here. There we go. First, I'll give you a little bit of overview about obesity in Colorado and why we need to increase physical activity. So Colorado is ranked the least obese state with an overall obesity rate of about 21%, but still 6 out of 10 Coloradans, or approximately 2.2 million residents, are overweight or obese. And obesity varies greatly by geography in Colorado. Our rural eastern plains, the obesity rates are as high as 35%, whereas in western Colorado, which is home to many of our resort and mountain towns, obesity is much lower, and in some cases as low as 13 to 14%. We also have varying rates by demographics. So African Americans, Hispanics, and American Indians have higher rates of obesity, and these same demographic groups have lower reported rates of physical activity. And we know that the research shows that the neighborhood environment can influence the ability to participate in physical activity. So in 2015, we surveyed over 12,000 Colorado adults, and we asked how important is access to safe places to walk as a neighborhood characteristic. And we found that 75% of respondents across all race and ethnicity groups said that this was very important. But when we asked to rate the condition of access to safe places to walk in your neighborhood, we saw significant disparities among demographic groups. And we saw that many different demographic groups were reported significantly lower than whites. And this data tells us that we really have a ways to go to meet the needs of our community members and to improve access to walking for everyone in our state. So shifting gears a little bit, I'll talk about our work to improve walkability in Colorado and creating more places to be physically active. So in 2015, we formed a group called Walk Colorado, and this is a multi-sector, multi-state agency team. And we were provided funding to attend a Walking and Walkability Institute that the CDC hosted in Nashville, Tennessee. So we attended a 3-day training, and at the end of the training we were told to go back to your state and think about what are some state-level policies that you can pass to get people walking. And in Colorado, it's where we like to be known as the most local state in the lower 48. So many of our policies don't really happen at the state level, they happen more at the local level. So as a team, we decided to think about what are some of the common barriers to walkability in our communities. And Charles, who is one of our team members who is a local elected official and also was the head of the Municipal League, told us that if you want to talk about walkability, you really have to connect it to economic development, and it needs to make sense for the bottom line for our local communities. And Shay, our planning representative, told us that Colorado communities, most of them have a state highway that runs right through the middle of town, and that these high-speed roadways create barriers to safe walking and biking. Gosha, our walking representative, told us that many communities do not know how to communicate with our State Department of Transportation, and they don't know what they can do in their local community. And then Betsy, our representative from the Department of Transportation, told us that there's lots of possibilities for working with CDOT to improve the design of the streets, but communities need to know what to ask for and when to ask for them. So as a response and to kind of address these common issues and barriers, we came up with a communication tool for local municipalities to engage with their state transportation engineers, and it's called Colorado Downtown Streets. The book is meant to aid Colorado communities as well as the Department of Transportation in striking a balance between the many demands that face our downtown streets, and in particular where Main Street is also a state highway. We know that the design of every street must be tailored to its unique circumstances and adhere to engineering standards and requirements. So this publication is not a substitute for the engineering process, and it's not really a design manual. It's a tool to aid in the development of thoughtful partnerships, compromise, and informed decision-making for improving our downtown streets. And we wanted to really make sure that the book was uniquely Colorado, so it only includes photos and case studies from our state, and because we knew that many of our local communities would not want to see any of examples from New York City or places where they didn't feel would fit within our Colorado context. So the book covers several different areas. It talks about why streets matter, what is a street, how to create great streets, which looks at how to diagnose issues that are creating barriers to safe multimodal use, as well as potential design elements to overcome barriers. And it talks about implementation, which includes how to work with the Department of Transportation and what options for funding. So in looking at why streets matter, the book talks about how streets are the fundamental building blocks of successful communities and how they play a tremendous role in shaping the character of a community as well as its physical and economic growth. And like I said before, it was really important to many of our team members to make sure that any of our talk about streets really ties back to economic development. So we talk about in the book how a walkable downtown is essential to a strong local economy and how that streets are essential to a successful downtown. Unfortunately, many streets are only focused on moving cars from place to place, but streets that allow for safe and comfortable multimodal use sets a stage for healthy, vibrant, and economically prosperous community. So to continue to back up our need for having local examples and a local case for streets being an economic driver, we worked with community builders, and they're also the organization that helped develop this book for all of our state agencies. And community builders studied the importance of streets and the way communities are designed when businesses or people are choosing where to locate. So the study only looked at the Mountain West, which includes Colorado, Idaho, Montana, and Wyoming, and surveyed people to find that many people prioritize quality of life over other factors in their decisions about where they live, work, or also start a business. And so it really shows us that building a strong and resilient economy starts with creating a community where people want to live and work, and that the quality of our community streets are an important factor in creating a great community where people want to be. And I don't know if you can see it, but on the bottom there we do have a link to community builders and their place value report and website if anyone wants to look at that. So the book also talks about street design and context-sensitive solutions and goes over several key considerations for streets, such as the context and making design decisions appropriate to the street setting and the surrounding land uses, safety, which is making sure to minimize injuries, function, which is balancing the street capacity with other community values, and placemaking. So really how the street design can move beyond utility and create a great place within a community. So today I'm just going to touch real quickly on safety and placemaking. So in the book we talk about speed and safety, and one concept that we talk about in the book is the driver's cone of vision and how much a driver can see at different speeds. This is an example of what a driver can see at 30 to 35 miles per hour. And as you can see, there is a person on the right there who's about to step into the crosswalk, and they're outside of a driver's cone of vision at this speed. Now, according to a Colorado driving law, if that person were to step into the crosswalk, the driver would need to stop. But as you can see, going at the speed, there's not much time to make those decisions, and it's also hard to see any of the other businesses or activities that are going on in the street. So if you were to slow the traffic down and slow the driver down, you'd really increase that driver's field of vision and be able to increase their awareness of the surroundings and the activities that are going on, and to be able to avoid collisions. So now we've slowed it way down to 15 miles per hour, and you can see people on either side of the crosswalks, but you're also able to take in what some of the businesses are, whether you can find parking or not, that you can really see a lot more by being able to slow down the traffic. And it also reduces the amount of stress on the driver and the pedestrians. So we just discussed these items in the book, so they are understood by all community members and local decision makers, as well as transportation engineers. So another item the book talks about is placemaking, and how streets can really move beyond moving cars to create great places within a community. And we talk about how this is an important concept to consider as you're coming up with a vision for your community, and that by coming up with some sort of vision, that gives you another coming up with that vision, you can talk to your local transportation engineer about what it is that you want to create, and that you really want to create a place and not just a way for cars to get through town, and that you can start that dialogue with your local transportation engineer to help you reach those goals. So the book has, let's see here, several visuals that help to describe that transportation terminology. Sorry. And that way it helps any of the community members or people reading the book really be able to communicate that vision using the same terms and terminologies that transportation planners and engineers use. So I'll just go quickly to the next one. One example of this might be looking at some different design elements and where they go within a street. For example, here we have the furnishing zone and then shade trees, how those would go into the furnishing zone. And there are opportunities for community members and communities to be able to add elements to their street to make them more friendly for people walking and biking. I just used the example of shade trees, but we go through many different examples of different elements that you can add into the furnishing zone or into the travelway edge as well. And I'm going through this kind of quickly because I know we don't have a ton of time, but they have plenty of information and links into the book as well. So another section that we talk about in the book is really how to work with the Department of Transportation. We heard from many of our communities that would say that, you know, the Transportation Department just showed up and started working on Main Street in our community. And, you know, these projects are typically planned many, many years in advance, so there must have been some sort of breakdown in communication, or maybe the right people weren't being communicated to. So we just talk about some different points in time where it's best to really start working with the Department of Transportation and where your plans can fit into their planning process. It also talks about really the importance of getting involved in your metropolitan planning organization or your transportation planning region to talk about your vision and your goals in your community so you can get your goals put into the larger statewide plan. And then we also talk about opportunities for funding and the importance of creating partnerships with other municipalities and shared vision and goals in order to be really competitive for funding. And then quick wins is another area that we talk about in the book. Transportation projects can be very expensive and they can take many years to complete. So we have some Colorado examples of things that communities were able to do with small amounts of money to test out designs. And then that way, when the Department of Transportation is coming in to maybe resurface the streets, they have some design ideas that have been tested that they'd like to make permanent. We also talk about the process that's needed if you are going to do one of these projects in your community, and what you would need to do with the Department of Transportation or a local municipality for permitting, funding, and then maintenance and all kinds of elements for quick wins as well. And then real quickly to kick off our book, we did a series of workshops with the 3 state agencies, which was Department of Transportation, Department of Health, and then our Department of Local Affairs, where we traveled around the state and to 5 communities and hosted workshops on our book. These were free for people to attend, and they are also able to receive continuing education credits. And we heard from many of our local communities that they were just really excited that the state agencies were coming to the smaller communities. Most of them were populations of about 4,000 to 8,000 people, and we had regional workshops there where people could come and then meet with their Department of Transportation representatives as well as people from the state agencies, and then learn about all the concepts in the book. And it was great to be able to get out into the communities and then have these opportunities in areas where normally workshops don't get to happen. So to wrap up here, we have all of our book information as well as several infographics and videos available online, and I have the link here at the end of the presentation. So these resources can be used to be able to build the case or make the case for redesigning great streets in local communities, and also for people to just have small digestible bits of information about streets. And we know that the book itself is uniquely Colorado and designed for Colorado, but at the same time, I think there's some great information in there that can be a template for other communities to be able to use in their state. So I just wanted to make sure there's a little bit of time for questions, so that's all I have right now, and I have my contact information as well as a link to where you can download the book. There's several different videos and also infographics as well. Thank you.
Great, thank you so much, Kate. That is a comprehensive resource, and it was really helpful to walk through your overall process, really the initial conversations across sectors through the CDC training to identifying different folks you want to have at the table and unpacking kind of the mysteries of planning for local decision makers and others. I think that's a really helpful format for us to consider as well. If you have any questions or concerns, please feel free to chat them in, and we've got a couple of minutes for conversation, and if folks have a few additional questions, we could always stay on the line a little bit after 3:30 Eastern Standard. I do have just one note about when the book was published, so it sounds like it was a very recent resource that you've put together.
Yes, we put it together throughout last year, and then it was published this last fall, and then our workshops took place in March of April of this year.
Fabulous. And we have a question about how you selected the sites for the workshops. I know you mentioned you're reaching out to smaller communities and folks who are excited to be part of the process. Was there an application kind of selection process, or how did you end up?
Since some of our work was, or the majority of our work was done through our Colorado Main Streets program, we wanted to select communities that were part of Main Streets and also that had a state highway running through town, so they would be a good example. So some of it was just reaching out to communities and asking if they were interested, and then also finding communities that would be easy for surrounding communities to travel to. So even though we hosted, say, in Brush, we probably had 5 or 6 surrounding communities that also attended that workshop. Hopefully we'll have funding to do more of those.
Great. And we've got a question here about equity. I know you mentioned in the initial slides different data points and recognizing that not all communities are experiencing rates of obesity at the same rate. Were you able to continue the equity conversation in the infographics in the book and the resource itself?
You know, I would say that our TAB survey data actually came out after our book was published. So we talk about it a little bit in the book, but don't dive into it as much. So we're hoping that as we continue to have some of the workshops or maybe have some additional resources to follow up with the book, that that's something that we can address further.
Great, thank you. And then we do have some folks on the line who are interested in evaluation and understanding how you might track some of the quick wins, or if you're asking communities to report back to you how they've used the resource or how they've used the book.
Sure. We did do a survey on the workshop that includes mainly more of the workshop presentations and some of the book presentations. So we're tracking that and what people's responses are. We haven't had like a formal process in order to track how people are using the book and resources. I think we can get some like analytics on how many people are accessing the resources. We have been trying to reach out through our partners to local communities as they're doing some of the quick win projects, so we can continue to write some of the case studies and talk about what's really working well and share that information across the state.
Great, and there are just a couple of quick questions here I might try to squeeze in if that's okay.
Sure.
In terms of identifying your case studies and really, it sounds like this could be a potentially overwhelming process. Could you talk a little bit about how you started to kind of cull the information and categorize in the early parts of the book writing?
Sure. For identifying some of the case studies, we did work with our contractor was Community Builders, who also does a lot of work in the western part of Colorado. So in working with them, as well as our Department of Local Affairs, which works with every local community around the state, and then our regional transportation engineers, we kind of had a discussion about who knows what's happening in many of our local communities and what are some things that we can highlight. So a lot of it was sort of word of mouth and what we've heard is happening in many communities. And of course, once we published and put out different case studies, we hear from many more communities about the great things that they're doing. So a lot of it was just word of mouth, or as different people had gone down to communities and visited and seen what they're doing with their streets. We just had notes, and that's what we should include. And but that's why we're hoping to create more of the case studies, because we're seeing more and more great examples from around the state.
Fabulous. And then the last question is a very practical one. How long did this entire process take you?
Well, we were kind of on a pretty short timeline in many ways in terms of creating the actual book and the videos and infographics. So we were able to complete all of those in about a 4-month process. But leading up to that, we had our workshop in 2015, and then after the workshop, our 3 state agencies continued to meet and kind of talk about that we needed this resource and that we wanted to do workshops. And so we started coming up with an outline of all the things that we would want in some sort of a resource. And then the Department of Local Affairs happened to have funding to be able to hire a contractor to put this all together. I think if it was just the staff from the state agencies working on this, it would take us years. But we were lucky enough to be able to find some funding, and then we had to have the project done quickly. So I think it took about 4 months to pull it all together.
Wow, that's incredible. I was not expecting, I was expecting years, decades maybe, not 4 months. That's fabulous, and certainly the opportunity to leverage the local affairs dollars is fabulous.
Yeah.
I know I said that was the last question, but we've got one more that just popped in, if you don't mind, Kate.
Sure.
So kind of thinking through the question of safety, most of the ideas were related to design elements, and this participant is wondering if there are other topic areas kind of outside of design that you talk a little bit more about, so engaging with local law enforcement perhaps, or thinking about potential local community groups for cleanup days or awareness raising. Is that part of the resource, or do you really focus on the street design?
The main focus is on street design, but we also talk about the importance of partnerships, and also how, you know, design can get you so far, but you really need to have partnerships in place in order to really make the design successful. And so, yes, that you would need to partner with your local law enforcement to make sure that you know, if you have posted sign or speed limits and things like that, that they are being enforced, and also to make sure your streets are continuing to be safe. And then in the quick wins section, we talk about the importance of community volunteers and how they can be a great resource in terms of being able to get projects up and going in communities, and also to help with maintenance and other elements.
Great.
But I think that's really, it is a very important, it's important to have those partnerships. And then as we're going around and talking through our workshops, we definitely bring that up. And we asked many of our local communities to invite local law enforcement, as well as schools and many other people, because they all need to have a voice in how our streets are designed.
That's a fabulous note to end this conversation on, Kate. Thank you so much for your time and sharing your resources. This has been a wonderful discussion and presentation. And for those of you who are still on the line, we will post a recording of this session on planforhealth.us as well as APA's YouTube channel, and you will receive an email from the GoToWebinar system with a copy of the recording as well. Thank you so much, Kate, for being here today, and thank you all for joining us, and have a wonderful afternoon.
Thank you.